Assalamu alaikum. I am Dr. Moniruzamman from Bashundhara Ad-din Medical College, South Keraniganj, Doleshwar. So today's discussion topic is the breast lymphatic system, lymphatic drainage and its artery supply and the alveolar systems. So this is a human being from side and this is a human being from front. Up to the diaphragm, this is thorax. Here is the diaphragm, this is thorax. Up to the, over the diaphragm there is thorax. Below the diaphragm there is abdomen. So abdomen, up to which it will be discussion of abdomen. But thorax is start from the inlet, thoracic inlet. Thoracic inlet means first ribs, sternum and vertebra. This is making the inlet of the thorax and this is making the outlet of the thorax. So this is the thorax, this is the midline of the body. We divided our body into two different parts. This is the midline of our body and the midline we have a breast. Both male and female we have breast. Okay. In the female there is a tail of the breast. This is called breast tail. It is found into the axilla. Okay. Then the point is, in the center of the breast we make it divide four quadrant. The name of the quadrant is, I will ask you, you will say it louder. This is upper medial. Of course, this is the medial of the body, so this is upper medial. This is upper lateral. This is medial. This is lower lateral. We divided the breast into four quadrant. No. This is upper lateral, this is upper medial, this is lower lateral, this is lower medial. There are some blood supply in our body. Every organ got blood supply. Our hand got blood supply by which artery? Which artery our hand got blood supply? Which artery? Brachial artery. Okay, brachial artery gives blood supply to this area. In this area we got blood supply through ulnar artery and radial artery. Now my question is, where the brachial artery comes from where? Axillary artery. So before brachial artery there is axillary artery. Before axillary artery there is? Yes, you are right. Before axillary artery we have subclavian artery. Before subclavian artery we have, yes, subclavian artery we have in our right side we have brachiocephalic trunk, isn't it? So there is our heart, there is our heart. From here arch of aorta is going down. From the arch of aorta there is a brachiocephalic trunk. Brachiocephalic trunk is going to the hand. Okay, before going to the hand, brachiocephalic trunk giving a branch to the head. So brachiocephalic trunk giving a branch to the head. This branch is called common carotid artery. Common carotid artery right side. Okay. So this is the common brain. It is going to the brain and face. Another common carotid artery directly coming from the arch of aorta. So this is arch of aorta. Okay. So he is coming over the breast. Can you see? Subclavian artery is coming over the breast and going to the hand, axillary artery and all of those things. Okay. So from the brachiocephalic trunk, after axillary artery, in the brachial artery, from the axillary artery there is a supply to the breast. Okay. Breast is getting supply from the axillary artery and by three branches. First branch is superior thoracic artery, which is coming from the very first part of this artery, subclavian artery. So this is called superior thoracic artery. Then this is called, in the middle, this is called acromio. So this is acromiothoracic artery, and the last is called lateral thoracic artery. Yes, this is the lateral thoracic artery. Okay. So if you asked how breast got blood supply, the first thing in your mind, it is getting blood supply from the axillary artery. We know axillary artery coming to the hand and giving the supply of the hand, but very fantastically, axillary artery is giving to the supply of the breast. So axillary artery giving 3 branch. The first branch name is superior thoracic artery, second name is acromiothoracic, exactly, and third name is lateral thoracic artery. These are the artery supply of the breast. And there are also some branch, lateral intercostal, there are intercostal supply, lateral intercostal artery also supply to the breast laterally. And there are also some perforating branches of thoracic internal thoracic artery also have some perforating arteries. They perforate and come to the breast. Okay. Now we know the artery supply of the breast. Again, internal thoracic artery, perforating artery, this is called superior thoracic artery, this is acromiothoracic artery, that is, and these 3 are branch of axillary artery. So breast is getting supply from the intercostal arteries and axillary arteries. If you ask in your viva, tell me the artery supply of the breast, how will you tell? Sir, internal thoracic arteries and axillary artery. Axillary artery have some 3 branches, sir. These are the branches. Okay, done. Now we know the artery supply of the breast. Now we need to know the lymphatics of the breast. How we know the lymphatics of the breast? Again, this is the breast and this is the breast tail. Okay. We divide the breast into 4 quadrant. Okay. Now this is upper medial, this is upper lateral, this is lower medial, this is lower lateral. Okay. Very nice. Now we know about lymphatics, lymphatic nodes. Do you know lymph nodes? How many lymph nodes in axilla? Who can answer? You can answer. How many lymph nodes in axilla? Jishan? 5 lymph nodes, yes. Name the lymph nodes. Central. First we need to draw it perfectly. This is our hand, hand is going down. So when his hand is going down, hand comes and hands comes and if you look at my hands, it is come inside, but there is a wall, axillary wall. So there are some lymph nodes. Anteriorly some lymph nodes, laterally some lymph nodes. So there are anterior lymph nodes, lateral lymph nodes. In my hand wall there is lateral lymph nodes, anterior lymph nodes and central lymph nodes. Okay. These are the lymph nodes of the breast. One is, tell me what name of the lymph nodes. First, tell one, any lymph node. What? Apical lymph node. Okay, I draw the apical lymph nodes. These are apical lymph node. Then central lymph node. These are the central lymph node. Then anterior lymph node. These are the anterior lymph node. Then lateral. These are the lateral lymph node. Then there are another 2 lymph node in the back. So there are posterior lymph node. So how many lymph node you have? 5. Again, these are, there are, and that are. These are the lymph node of the breast. Okay. Now come to the discussion. Now we need to know some other lymph nodes. There are some other lymph nodes to support the breast. What are the other lymph nodes to support the breast? In the center of our body or the medial part of our body. This is the midline of our body, right? So there are some lymph nodes. Can you tell me the name of these lymph nodes? Paraesternal lymph node, yes. Sternum and its side. So because of the side of this lymph node, this is called paraesternal. If you stand beside of mine, your para of mine, parallel. We said no, rail line is moving parallelly. So it is just beside the sternum. So it is called paraesternal lymph node. And another lymph node there is internal mammary nodes. Where are the internal mammary nodes are located? So there are some internal mammalian lymph nodes. Okay. Then in the abdomen there are some lymph node also. These lymph node are called peritoneal, subperitoneal lymph node. So there are some lymph node also, subperitoneal lymph node, and there are some lymph node also. These lymph nodes are called. So these are the posterior intercostal lymph nodes. Now see the direction of its. All the lymphs that is accumulated in here, upper medial, these are going to these lymph nodes, paraesternal lymph nodes. All the limbs are accumulated in upper lateral, these are going to apical. All the lymph nodes are here, these are going to the axillary lymph node and costal lymph nodes. But the lymph accumulated in this area, upper medial, it is lower medial. Lower medial. This is going to this channel and going to the subperitoneal channel. Again, upper medial is going to the paraesternal. Upper lateral is going to the axillary lymph node. Lower lateral is also going to the axillary lymph node and intercostal lymph nodes. Lower medial, they are going to these lymph nodes and below. So they are going inside into the abdomen. And these lymph nodes use these channels. There are liver, there are uterus. So if these lymph nodes are involved, it involves the liver. If liver involved, it involves the uterus. Okay. So if infection or if tumor or if carcinoma involved in this area, there is a chance to spread these agents or this cancerous chemicalous, those structures are going to involve these areas also. Okay. After that, we are going to discuss about the alveolar system. Suppose this is the omen. So omen has hair, of course, and you cut this omen. What you will found? Nothing but there you will found a sternum, okay, and some ribs, okay. You found some ribs over, okay, fine. Over the ribs, you will found what? A muscle. This muscle is a massive muscle. This is called pectoralis major muscle. The muscle in the chest, in case of male, this is so prominent, and if the person do exercise, this muscle become big. This is called pectoralis major muscle. Over the pectoralis major muscle, in case of female, there is a ligament. This ligament is called suspensory ligament. Which ligament? This is a ligamentous structure. This is a ligament. Can you see the ligaments? Okay. In the ligaments, there are some ducts. That is why the ducts are not moving here and there or not override with one another. How the duct is looking? The duct is something like this. Here is a duct, 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 Here is the duct. All the duct open through a channel. Okay? Of course. Now, this duct, this is called actually, these are called, okay, I draw one of those very largely. This is a large version of this. Can you see this? One large version. This is called lobe. 1 lobe, 2 lobe, 3 lobe. So how many lobes in a female breast? Any idea? 15 lobes, of course. So you will get 15 lobes to 20 lobes. Okay? Okay. In the 15 to 20 lobes, you will get this sinus like this. Okay, if I draw over this breast, it will be more convenient. This is something like this. 1 lobe, 2 lobe, 3 lobe, 4 lobe, 5 lobe. Can you see this lobe? All those lobes are coming and opening through this channel. There is a channel. So all the lobes are coming and opening. The opening is this, and the opening is called duct. This is the duct. The area of open is called duct. The area of open is called the duct. So this is duct, this is lobe. So what is that? What is this? This is called sinus. This is called sinus. We say this is lobe, this is duct, and this is the enlarged area. This is called sinus. This is called what? So every lobe has a sinus and a duct. Every lobe has a sinus and a duct. It is important. The structure is just like this. So the scientists want to see the inside of the lobes. What is inside of it? What is inside of a lobe? A beautiful structure found. Inside of the lobe there are some alveolar and acinar. What is alveolar? Do you hear this name alveolar? Alveolar structure. What is alveolar? Balloon like structure. Okay. Let me draw. Inside of the lobe, inside of the duct there is another channel. There are some alveolar. These are the alveolar. Okay. Inside of this, some filtration occurs. You received artery supply. It receives bloods. So inside of this there are bloods. There are hormonal mixtures. You take foods. All the chemicals going inside of your body. These alveoli are summarizing all those things. They take the blood, they take the hormone, they take all those things, and they secrete something. And this secretion is called milk. Okay? Our body used to produce different kind of things by using our body materials like bloods. Suppose how urine is formed. Urine formed by filtration of the blood. So urine is forming filtration of the blood. We give all the drugs in our blood. We give all the foods in our blood. What you take in your breakfast today? Kheera. Only kheera. That means cucumber. What you take? Apple. What you take? How much health conscious? What you take? The unhealthy boy. Yes, I like you. So this unhealthy boy take paratha. Paratha, inside of the paratha there is oil, and all those structures going inside of the body, mixture with the blood and going in the brain will be dull. That is why his brain is dull. You take apple has glucose, brain need glucose, Parota has carbohydrate, carbohydrate also produce glucose, but what you take, that is garbage. But you take apple, is a very good thing. It has glucose, fructose, all those mixtures filtered by your blood going into the brain. You are so sharp. You are also sharp. I am not, I don't want to insult anyone. So, what we earlier know? We know these structures are producing milk, not every time, not in case of male, not in case of below puberty, or not in the just after marriage. It secretes milk when it needs. That means a signal need to come from the brain. Okay, you can secrete this. This signal come to this there. When the signal comes, there are some hormones. When a person got pregnant, a signal from here goes to the brain. Yes, it got pregnant. And brain sends signal to every organ. Yes, this person get pregnant. So when brain gives signal to the breast, these ducts are active, and they start filtering bloods and all of those things, materials accumulate those things and producing milk. And some patients are not capable to doing this. We stimulate by drugs. We give some drug to reactivate those things. Some patients has not that much capable to active those areas. So this is today's discussion. Thank you very much that you are listening to me. In our further class, we will decide more thing about breast and all of those things.